Hello, everyone. My name is Radwa. I did my presentation on right side heart failure. So our agenda for today is we will discuss our patient, her symptoms, her physical findings, her diagnosis, as well as her treatment plan. Let's meet our patient. Our patient is a 79-year-old African American female, JA. She presents to our outpatient clinic with a chief complaint of persistent cough, fatigue, increases in work of breathing, unexplainable rapid weight gain, even with her lack of appetite and her nausea, abdominal bloating, and she's also complaining of swelling to her bilateral lower legs. Upon further evaluation, the patient is found to have JVD. She has a +2 to 3 pitted edema to bilateral lower ankles. The patient also reports dyspnea that is triggered by less than ordinary activities. She also sought medical care in the past due to her abdominal enlargement, which she was diagnosed with ascites at the time. She is allergic to ACE inhibitor medications, morphine, seashells, and tape. She has a past medical history of CAD, hypertension, ETUH abuse. Her last drink was 1 year ago. She is an ex-smoker who smoked for 11 years, approximately 2 packs a day. She is diabetic, has history of obesity, COPD, ascites. She recovered from COVID back in July of 2022. Has no surgical history. Her current medications are as follows: imodipine, spironolactone, furosemide, omeprazole, and ferrous sulfate. So her vitals are as follows. Her weight is 108 kilograms. She is 1.75 meters tall, which that calculates her BMI to be 35.3, which puts her in the obese category. Her current blood pressure is 90/50. Her heart rate is 60, and she's setting 92% on 2 liters of nasal cannula. She is in mild distress. She is in tripod position. Patient became extremely short of breath while lying down. Um, that's why she's sitting up. She has shallow respirations, has persistent cough, difficulty concentrating, decreased alertness. So for her clinical presentations, she has the hallmark features of right-sided heart failure. She is fatigued, she's weak, a bit lethargic with a decreased alertness. She's been complaining of reduced ability to exercise. She also stated that she had very rapid weight gain, complaining of GI distress, her nausea, and persistent cough. She also has increased abdominal girth, has JVD, her dependent edema in her lower bilateral extremities, has ascites, and has enlarged liver and spleen. When palpating her liver, you can feel it below the right costal margin. She has a presence of jugular reflex. So we send this patient for an EKG, to get an EKG done, get an X-ray, and also an echo. So her EKG shows that she is in sinus rhythm, but has indirect signs of right atrial overload. And that is shown by having a wide variability of small wide QRS amplitude that is found between V1 and V2. She also has left atrial overload, which shows as prolonged and notched P wave. In the middle in the middle picture, her X-ray shows cardiomegaly and interstitial lung infiltrates. The one at the bottom shows the lateral view of the X-ray, which showed right ventricles markedly enlarged. And the picture all the way to the right, that is her echo. It's a view of her four-chamber view, and it shows marked enlargement of her left and right atria. So she is diagnosed with right-sided heart failure based on the hallmark features, her clinical presentation, as well as her images that we just saw. Um, she does have a lot of the risk factors for right-sided heart failure, which includes her being a female, being African American, history of hypertension and infection, which she did have COVID in July, obesity, diabetes, CKD. Also, the fact that she was a smoker and a drinker, and she's over the age of 65. Her eating habits, probably her inactive lifestyle, her alcohol use disorder. Um, Other factors also include one's income and their geographic region also affects the them developing heart failure. For her diagnostic studies, after an extensive and detailed HMP, the provider will continue the evaluation with chest X-ray, EKG, and an echo that we have done. The EKG helps us to determine if parts of the heart are enlarged or overworked, while the echo with a Doppler really uses sound waves to take moving pictures of the heart chamber and valves. It also helps us with knowing the patient's ejection fraction, which is one of the most important measurements when it comes to heart failure. Um, a patient can also get a cardiac CT scan done of the chest. That can be done with or without the dye, and that provides a more detailed picture than the ultrasound. They can also go for a cardiac catheterization, which is pretty much a contrast material that is injected through a tube, and it's a type of X-ray movie that is taken to show the blockage in the heart. This procedure may be done along with coronary angiography, which that allows the provider to study the blood flow through the heart and the blood vessels to detect any blockages that the patient might have. Other diagnosis testing can include pulmonary function test as well as ventilation perfusion scan of the lungs, which we all know as the VQ scan, stress test, nuclear stress exercise test for individuals who are able to actually to complete that test. Um, Blood work is, of course, drawn to assist the providers for signs of other potential diseases that might affect one's heart. So, at the very beginning, their initial lab workup would include possible testing of blood antibody tests, including autoimmune lung diseases, CBC, and ABG would be done, blood lactate urinalysis, serum electrolytes, kidney function, would test their BUN and creatinine, their blood sugar, liver enzymes, and their thyroid function. Blood work should also include markers of end organ function to assess really the severity, which includes renal and hepatic panels. D-dimers is drawn because it's useful in a diagnostic workup of any suspected PE. BNP and the cardiac troponin are drawn as they are highly sensitive for early section of heart failure and MI. So how do we treat someone with a right-side heart failure? So the treatment really starts with an assessment of the severity of their condition. The goal is to control the symptoms. You can't fix heart failure, but you can maintain the symptoms. Many treatment options are available. However, the cause of it will determine which treatment is more appropriate for the patient. Once the patient has been diagnosed and their treatment has been initiated, they'll be closely monitored during their treatment, just to watch for any side effects, to see how well the medication and the interventions are working to control their symptoms. In some cases, the patient will be on oxygen, and they'll be on oxygen at home. Beside that, the patient will be placed on one or several medications at the same time. Those medications include diuretics, and the reason for that it will help rid the body of excess fluids and sodium. The reason for that is fluid management with diuretics helps to maintain the right ventricle's ability to fill with proper amount of blood for each heartbeat. With this medication, the patient will need frequent blood work to assess electrolyte, especially their potassium level. They can also be on vasodilators. As we all know, these drugs help blood vessels relax, so the heart doesn't really have to work hard, and interrupt their chemicals and weaken the heart. Two widely prescribed vasodilators would include angiotensin receptor blockers, in other words, ARBs, and angiotensin covering enzymes, ACE inhibitors. Beta blockers that help slow the heart rate, easing the workload of the heart muscle. They can also be on digoxin, which is a drug that helps strengthen the heart's pumping ability. It's typically used in the more serious cases of heart failure. Pulmonary vasodilators. This is just in the case that pulmonary hypertension is the reason that's causing the right side heart failure. These medications relax the blood vessels that is going to the lungs to unload the heart. If none of these interventions, which include the AICD or the ECMO or any of the medications stated above, then really the last resort for this patient is a lung or a heart-lung transplant. Beside the medications and the interventions that the health providers will do for the patient can also do other things to control their symptoms and alleviate some of the symptoms. So they can quit smoking or stop drinking alcohol, which in my patient's case, she was a smoker and a drinker, and she quit both. So she's okay with that. She can also work towards a healthy weight. She can track her daily fluid intake, eat a heart healthy diet, which is not so easy at times, regular exercise. She can also avoid strenuous activities and lifting heavy things. She can manage her stress through yoga, meditation, get plenty of sleep at night. That's almost impossible. Keep track of any symptoms. She can also monitor her own blood pressure at home and follow up with her regular appointments to her cardiologist and such. She can also get all the recommended seasonal vaccinations, such as the COVID, pneumonia, and the flu, if she is prescribed oxygen, to use it as prescribed at home. And women with heart failure shouldn't really get pregnant, as it makes their symptoms worse. Those are my references. Thank you so much for listening to my presentation. I hope you enjoyed it and you learned a lot. Thank you so much.